So, antitussive drugs come in two general types. The first are in the opioid group, and they are drugs such as hydrocodone or codeine, and then butorphanol. And non-opioid antitussive drugs are dextromethorphan. This is one that you'll find very commonly in over-the-counter preparations. Hopefully you've recognized that the opioids are going to be in the controlled substance category usually. So hydrocodone, we'll start with this one. Hydrocodone has a high potential for abuse and so is not as available as it used to be. Um, Probably if the veterinarian's gonna prescribe this for a cough in an animal, it's gonna be a pretty short course. And hopefully we're addressing the cough in other ways, but it's not going to be given for a chronic situation. Um, and it is part of our job to pay attention to animal owners that come in specifically seeking opioids. Usually it's for pain relief rather than for cough relief, but sometimes people find out about these uses and request them. So it's just something to keep uh, tabs on, and some states will require even veterinary owners to be registered in a basically a list that shows what kinds of prescriptions people are obtaining from all different sources. So that's not really widespread practice right now, but I think it's coming on the horizon that it's recognized that owners will sometimes seek opioids from veterinarians, and unfortunately, sometimes they will harm animals in order to create pain so that the veterinarians will prescribe it. But some folks may take this tack of looking at, hey, my animal has a cough. I need to have something for it. Okay, so this is a C2, Schedule 2 controlled substance, which is pretty high on the list as far as having a potential for abuse. The main thing that opioids do is they suppress the respiratory system, which the main thing that they will do to suppress cough, I should say, um, is they will suppress the respiratory center of the brain, and this will suppress the cough. So that's how they act. Hydrocodone is pretty good against cough, but because the potential for human abuse, it's not prescribed that much anymore. So two others that are in the opioid class are codeine and butorphanol. Codeine is commonly found together with things like Tylenol and is used as a pain reliever. So if an owner for some reason decided to use this to treat a cat for cough or for pain with such a medication, we'd need to um, help them learn that that's not appropriate to give to a cat. And so, depending on the concentration, it may be either in the C2 or the C3 schedule as far as where it is. Similarly to the hydrocodone, it affects the respiratory center, and all of the opioids have the potential for some sedation and also for constipation. And if you remember back in our GI tract, we talked about some opioid that would help with stopping diarrhea. So that is, it creates more segmental contractions and less peristaltic contractions. But when it's prescribed consistently, it can cause a fair amount of constipation. So, so just be aware, codeine is combined with other drugs commonly. Butorphanol is one that is probably going to be the most common that you're going to prescribe for cough or you're going to see prescribed and you're going to dispense for cough in your clinic. And the reason is that butorphanol is very readily available. We use it usually as part of an anesthetic protocol. The butorphanol is quite often given pre surgery for some pain control, and sometimes it's given after as well. It's in an injectable form, it's in an oral form. The oral form has a very significant first pass effect, so the dosage for giving it orally is quite different. It's going to be much higher than the injectable. So this is one, it's a Schedule 4 drug. We feel okay about sending it home with owners. And as I said, usually with cough, we're going to be looking for about a week's action or so, and hopefully be going after that cough in some other ways. So dextromethorphan is not an opioid. This is a drug that is very common in over-the-counter cough preparations and is the ingredient that is used most often for stopping coughs. It is, I mention it not because we use it a lot, I mention it because owners may think to use it. And the unfortunate thing is because it is combined with other drugs very commonly in these over-the-counter preparations, people may think it's appropriate to use in their pets. So some of these things are in syrup form. They may have xylitol in them. They're combined with other drugs, sometimes Tylenol. So we want to make owners aware, if they ask you, why can't I use this Robitussin? I have it here. We want to make them aware that it's usually not that helpful. It's not as helpful in animals as it is in people, so we don't use it because of that. And would have to be sure that it was absolutely just dextromethorphan and not combined with something else that would be undesirable. So it's just something to be aware of. To talk about some other drugs besides antitussives for treating cough and respiratory conditions. And these include mucolytics, expectorants, and decongestants. And we'll take them one at a time and tell you what they are and um, which ones we use. So first of all, we'll talk about mucolytics, and they break up or lyse mucus. They basically make it more fluid-like. The term viscosity refers to a stickiness, and as respiratory secretions and mucus are produced in response to an inflammatory process. They become, as they kind of age, they dry out and become more sticky. Also, in an inflammatory process, inflammatory cells are released, white blood cells are released, and monocytes, and they will um, eventually die after they've done their job, release their DNA, and that DNA combines with protein in the mucus to form disulfide bonds. These disulfide bonds cause that stickiness to occur in the mucus. So some things that we can do that are low tech to break up sticky mucus are simply rehydrating an animal. We can rehydrate them by giving them a diet with more moisture in it, a broth in the case of dogs or cats, just wet food, anything we can do, feed a gruel to horses, um, anything we can do to rehydrate the animal. We can also use what's called nebulization. And nebulization is simply the creation of a mist with a medication in it that an animal breathes in. And that's what's going on. This is a nebulizer in this picture, and it is sending a mist via a tube into this muzzle. There's probably a seal around here so that the horse is just breathing this mist in. In this case, it's just a saltwater mist. Salt water can be very soothing to mucous membranes. And lastly, we can put animals into a steamy bathroom, but that will only get the steam, which is essentially a mist, again, only so far into the lungs. It usually doesn't get that far down, but it may relieve some of the mucus that occurs in the nostrils and up above the larynx area, and that may be helpful to an animal. So those are low-tech ways to break up mucus. This is a drug that we use to break up mucus. It's called acetylcysteine. The human products are Mucomist and Mucosil, and they simply break up those bonds and make the mucus more fluid-like. We can administer it as a solution by mouth, or we can deliver it via nebulization. And this is a delivery system here. This is, again, a muzzle with a seal around it. And this is an opening, a port that would allow air to come in when the horse breathes, but doesn't allow the mist that's going to be delivered to the horse to come out. So it's kind of a one-way deal. There may be an exhalation port as well for this. But this is the drug that's just delivered in a little nebulizer puffer sort of thing into the inhaler, into that chamber, and then the horse breathes it in. Unfortunately, we have to use a bronchodilator with this drug because it causes bronchoconstriction. So it's irritating enough that it causes bronchoconstriction, but it does help break up the mucus. Just so you know, acetylcysteine is also the drug that we use, and we use it in IV form for treating acetaminophen or Tylenol toxicity in cats. Next, we're going to talk about expectorants, and expectorants add fluid to the mucus and dilute it. And so they differ from mucolytics in that they're not breaking up mucus, they're just simply diluting it by adding more fluid. It's probably better to think about hydrating an animal before considering reaching for these particular drugs, because what's going to happen with hydration might simply take care of the situation, might loosen up that mucus enough that we don't need to give them anything else. And giving an expectorant is going to cause more fluid that has to be brought up from the lungs and then spit out. The term expectorate um, is means basically to spit. So that's that's how these drugs are named from them. So we don't often give these types of drugs. The main type that we might give is guaifenesin. It's also known as glyceryl guaiacylate, and there is a shortened term for that even, which is GG. So all of these are the same drug: guaifenesin, glyceryl guaiacylate, and GG. And it basically is given orally. It stimulates the parasympathetic nervous system by irritating the GI mucosa, and that stimulation causes an increase in secretions in the lungs. It's known by these forms: triaminic, Robitussin, AC, and cough tabs. It does cause drowsiness. So we don't reach for this first thing, but for some situations it may be a real help to create a little more fluid to get things out of the lungs. And unrelated, but uh, another effect of this drug is to provide muscle relaxation as part of an equine anesthetic protocol. So very different action that it's used for in that situation. It's given IV for that purpose. So it will not cause the stimulation of the GI tract and the expectorant effect when it's used for equine sedation. Um, just to mention it, we can stimulate secretions in the respiratory tract by using volatile oils. They simply irritate the mucosa and then cause an additional amount of fluid to be produced. We don't use these a lot in animals, but you will see people going to spas where they have eucalyptus rooms that basically create more mucus, and they may mention that. Why don't I just get some eucalyptus? Use that for my animal. All right. Decongestants. This is another one that we don't use a lot. It basically decreases the blood flow to the mucous membranes in the nose, and that's what helps us breathe better. It affects our alpha-1 receptors that then will cause vasoconstriction, and that relieves that congestion. They also tend to act on beta-1 receptors and increase the heart rate. So we don't use this a lot in veterinary medicine. Again, it's in a lot of over-the-counter preparations that people may think to use on their animals. The typical names are phenylephrine, and pseudoephedrine.